This is a quick video for mobilization of the first MP joint or metatarsal-phalangeal joint. Looking at the foot, that's the first metatarsal, and here's your first phalanx of the big toe. And to mobilize this joint, you need to stabilize the first metatarsal while also stretching just the first MP joint without stretching any other joint in the foot. While you do this, you want to avoid compression through the sesamoids. The sesamoids are two pea-sized little bones that are encased in one of your flexor tendons on the underside of the foot. So to find those, you just feel the thickest part of the joint and drop back where you can no longer feel that thick area, and you're more on this first metatarsal, the long bone behind your toe. You're going to take your other hand and grabbing just that bone and not the nail bed and not this IP joint, but rather just that short bone there. And what we're going to do is distract. So with a longer motion here, just show distraction this way, as well as flexing down to gain plantar flexion. Often you can take your opposing thumb and support the mobilizing thumb this way to create that stretch. And what you want to do is a low load, long duration stretch on that joint. And what that means is pressure on the joint and then holding it steady without bouncing for up to 2 minutes. Once the 2 minutes is up, relieve the pressure slowly, and you may have a little bit of soreness going down, which will fade, and as you release, you may have some soreness as well. After a short rest, you can do that again. For extension, it's the exact same rules, avoiding compression of the sesamoids, avoiding mobilizing that proximal joint on this end of the first metatarsal, and moving into extension. Often if someone's helping, extension can be performed in this direction. Again, stabilizing that joint, distracting slightly and pushing up. Again, reinforcing with your opposing thumb or your opposite thumb to help that mobilizing hand out, while also stabilizing here. Again, avoiding the sesamoids there, the little bones under that big toe. And that's how, in short, how to mobilize. So low load, long duration stretching for this joint. Think of this as stretching a plastic bag with just a little tension, but holding it, and that plastic bag's gonna slowly stretch out. You wanna gain about 15 to 20 degrees of plantar flexion and at least 60 degrees of dorsiflexion at that toe.